Good morning. My name is Ann Brazo. I'm the CEO and founder of MPN Advocacy and Education International. I am hosting today, or we are hosting today, a pediatric and young adult discussion roundtable. Our guest speakers are Dr. Nicole Kucine and Dr. Linda Resar. They've partnered on some projects and they have been absolutely wonderful. Dr. Kucine partnered with us in the very beginning when we were looking at young adults and pediatric MPN issues. Dr. Resar is a pediatric hematologist as well. And we have some younger people with us today that have been diagnosed with an MPN that will share their stories. And we also have some parents of young adults who will share their perspectives from the parent point of view. And so I'd like to introduce Dr. Kucine first. And of course, your questions are welcome. Please post those or send them to Mallory, and she will get those to me, and we will try to answer all of your questions. We're here until 1 o'clock, and please join us. Don't be afraid to ask a question. Dr. Kucine is with Weill Cornell in New York City, and please welcome Dr. Kucine.
Hi, everybody. Thanks, Ann. Hello, happy Tuesday. Thanks for joining us. So as Ann said, I work at Weill Cornell Medicine in New York, which is a hospital with a long history of taking care of patients with MPNs. I am a pediatric hematologist oncologist, so I work with patients up to the age of 21, and I cooperate with the Silver MPN Center here at Cornell. And I apologize if you hear any weird noises. There's some fire alarms going off outside my office, but there's no smoke, so I think we're fine. So I didn't want to talk for very long, but I just kind of wanted to, for folks who I've not met or chatted with before, just introduce a little bit of what I do. So at Cornell, we have a dedicated pediatric MPN clinical and research program where our goal is to really learn as much as we can about MPNs in young patients, since historically we know that they've been thought of as diseases of older adults, and we're really learning that that's not the case. So we are very interested in learning as much as we can about our youngest patients. We've seen patients as young as 2.5 up to 21 years of age. I enroll patients on my research studies from all over the country, which is great. I think one thing many of you recognize is that families of children with MPNs are very interested in being involved in research and being involved in community of the MPN community. So I think that's great. Just a couple of things to highlight that we're working on now. So as you probably know, there are 3 main genes that drive a lot of MPNs, but in kids, we don't always know what's driving them. And we don't know a lot about things like secondary mutations that can have an effect on prognosis or outcomes in adults. We don't really know much about that in kids. So we're trying to learn more about that. So with colleagues at Sloan Kettering Cancer Center, which is across the street from Cornell, and that's where I've done my training and worked with them for many years, we're collaborating to look at sequencing panels in young patients with MPNs. We're actually trying to compare them to different groups of both young adult and older adult patients, working with Dr. Rajit Rampal and Dr. Ross Levine over there. And we've been doing that for a little while, but we're happy that we just got notification a couple of months ago that we received some funding from the MPN Research Foundation through their Thrive initiative to continue that work. So we'll be able to do more sequencing this year. We presented some of the early data at a poster at the American Society of Hematology meeting last year. And we're hoping that we'll be able to sequence a lot more patients this year and put all that information together so we can really learn some more about genetic mutations in kids with MPNs to understand the role they play. And another thing that I'm really excited about right now is that, as you may or may not know, there are a lot of different groups all around the world who study MPNs. There's, researchers in the UK, in Germany, in Italy, in France, really all over the world, who are very interested and invested in studying MPNs. And it's been hard, at least previously for us from the States, to really get involved in doing collaborative work with folks in Europe and Asia and abroad for a variety of different reasons. And so this year we were able to start working together on some collaborative research, which I think is really exciting. And Dr. Resar and myself and Dr. Abuzena, who's one of the adult oncology doctors here at Cornell who sees young adult MPN patients, are working with some world-renowned MPN experts from Germany, from France, from Italy, and we're going to be working to develop transition of care guidelines to help patients and families manage transitioning from the pediatric hem-onc space to the adult clinical care space, because that is a very different world, and it's an important thing in a lot of different disease groups, something that's been studied a lot now in things like sickle cell disease, in inflammatory bowel disease, and cancer survivorship. So we're really trying to look at that in the MPN space, which hasn't been done before, and it's a really nice way to collaborate together. And we're also hoping that by doing that, we'll also maybe be able to start generating some, expert consensus guidelines on management. It's very hard to do clinical trials and things in pediatric patients. It's something Dr. Resar and I are actually working on with the Children's Oncology Group now, trying to develop the first clinical trial for ROPEG interferon in pediatric patients. That's never been done before. But things like clinical trials internationally can be quite tricky. So we thought starting with something like a transition guideline and a consensus statement on management would be a really nice way to put a bunch of experts from different countries together. And once you sort of demonstrate that you can really form these nice consortium, I think it's a great stepping stone to then doing more clinical studies abroad and really working together to answer more questions. So that was just some of the stuff I thought was interesting to share with the group. I didn't really want to talk for too long because I know that we're going to have a lot of time for questions and discussion, and I want to hear from patients and families as well. So I'll leave it there and I'll turn it back to Anne, and then I'm happy to take any questions that come up later during discussion.
Thank you so much. It's so fascinating. And, we've been working with MPN docs around the world ever since I started this organization. And it's fascinating to see how different countries do things that, some of the things we're doing are fantastic, but boy, we have to pay attention to what's happening globally. And so I'd like to introduce Dr. Linda Resar from Johns Hopkins, and thank you for joining us, Linda. We always appreciate it. And what would you like to share with us today? Your microphone needs to be, yeah, there you go.
Okay, so first, I just wanted to thank you, Anne, for getting us all together. I think that's actually how I met Nicole, and we've been super excited about our collaborative studies to try to learn more about pediatric MPN so that we can identify the best treatment options and keep you healthy. My goal is 100 years. And so it's wonderful to see you. I haven't met you yet, Allison, but Portia, we met some years ago in New York City, and Cam, I've met you on video. So it's wonderful. You both look terrific, and it's great to connect again. So some of you may know my laboratory has been focused on myeloproliferative neoplasias. We are really invested in understanding what are the underlying causes for the stem cells to expand, how they progress into myelofibrosis when that happens, how they progress into other problems, and what we can do to prevent that. So we actually have mice with PV, we have blood cells from our patients. We've been doing, I think, really super exciting collaborative studies with Nicole's group, trying to understand how do our young patients differ from older patients, and how can we, keep the blood stem cells of our younger patients healthy. So that's been just very exciting work. We recently had a paper published in Blood where we look at a chromatin regulator that seems to be key for driving progression. And so we're continuing to focus on that and try to figure out how we can block it from causing disease to progress. We've been excited to work on different trials in pediatrics. We, as Nicole mentioned, we reported the first group of children who received interferon, and those results were incredibly promising. MPN, I should mention, is very near and dear to my heart. My mom also has MPN, and she's 86, doing great. And so I want you all to get to, 106, but she's a good role model for us now. We also recently put together another really exciting publication on some of the clotting complications that our young patients have. And then with my colleagues here at Hopkins, we had a unique opportunity to take our entire cohorts. So long before I was even here, and I've been here over 30 years, Dr. Spivak had been setting up a program which consists of over 600 patients. And so some of these patients were diagnosed as children, less than 20. Some were what we consider adolescents and young adults, so less than 40. And we had very long follow-up. So we recently put that experience together in the British Journal of Hematology. The good news is our young patients tend to do well. We were able to look at the scope of the mutation, something that Nicole is very interested in, and what kinds of complications, how the patients did. And all this is incredibly important, especially going forward, because the retrospective data are patients diagnosed in some cases 50, 60 years ago. And fortunately, this is a field that's rapidly growing. Like Anne said, we communicate and we interact with our colleagues in Europe. We're trying to really move the field and keep you all healthy. And so I'm always really excited to be here, and I've been thrilled to be able to collaborate with Nicole on her exciting studies.
Well, we're very happy you're both here, trust me. And you mentioned something years ago. So I've been in the space 20 years. Can you believe that? 20 years in the MPN space. So I went to my 20th ASH conference this year. Anyway, I remember going to UCLA and meeting with their hematologists, and this was years ago, and they had an infant who had MF. And they were everybody was baffled and trying to figure out what to do for this infant. Of course, it was all those years ago when there was nothing on the market that was specifically for an MPN. And I just remember thinking, when is that going to change? How is that ever going to change? But here we are today. So what I'd like to do now is start with Allison, because she's kind of unfamiliar with us and this, and she's getting to know us, but I want to get to know her better too. And we should all get to know her. Allison, would you mind sharing your story? Like, when were you diagnosed? Are you on medication? Who's your physician? That kind of stuff, if you don't mind, and how you're doing.
Yeah, of course. Well, thank you for having me. It's nice to meet you all virtually, but I'll just get into it. But I was diagnosed in July 2021. The year before that, I was kind of just feeling off. So like, I just felt something in my body wasn't right. At first I thought it was my hormones. So I kept on like pushing that kind of perspective. But every single time I got blood work, the only thing that was consistent was my increase in my platelets. So over that course of a year, I had many tests done. And then finally, I was referred to a hematologist in May of 2021. And she ran through all like the normal tests that, like anemia and things like that. And then she said, I'll run this one last test only if it gets approved by insurance. So I was like, okay. She's like, I highly doubt you have it. You're young. And this is more of you hear that typical of an older, median age between 50 and 60. But then sure enough, like a month later, it took a while to get it approved, but then the test results came back positive for the CALR mutation. So then from there, the doctor kind of referred me to Dana-Farber. This was in Worcester, Massachusetts. And she said that, which was pretty nice and honest, is that I'm not really sure where to go with you from here, because I was 29 at the time. So she said, I think that you would be better off going for a second opinion in Boston. So from there, I had 2 bone marrow biopsies, because the first one I got done was inconclusive, which was not enjoyable. But my physician, or my hematologist and oncologist, is Dr. Luskin in Dana-Farber. But I saw Dr. Morale too. Both are great. And as of right now, it's kind of just like monitoring, and my platelets have been going up around like 50,000 every time I get checked in. I do usually 6 months at a time, so I go in person, and then every 3 months I get my blood drawn just at a lab outside of Boston. Right now, I'm just on aspirin as needed. They said I kind of caught it, just as it was progressing. So when I first had my platelets increased, it was only around like 500,000. But ever since then, it's just been like a gradual increase, and it's kind of been all new to me. I think that that's kind of where it's been more of a shock, is like the mental side of things, and where do you go from here, and hearing that it's all it's a chronic thing that you're going to live with and deal with for the rest of your life is kind of a shocker. And it definitely took like a year to fully, like, I guess, not only comprehend it, but like accept it.
Mhm.
And I think that's been the hardest part. So far, I just have like very mild symptoms, like fatigue is probably the biggest one, as well as some like extra bruising and things like that. But fatigue is where I feel the most symptomatic. And yeah, I don't know if there's any other things you want me to discuss. But
No, I mean, well, that was it in a nutshell.
Yeah.
And it honestly is a story we hear repeatedly. You know,
Yeah.
you're not alone for sure. You are not alone. And, but I'm so glad you went to a hematologist. You're in great hands. You know, we know those people pretty well and you're in very good hands. How are you feeling lately? You said you still have a lot of fatigue, which is very prominent, you know, with
Yeah.
MP pervasive. Yeah.
Yeah, I actually had my 6-month follow-up a week ago. And they did a questionnaire to like monitor my symptoms, which was a newer aspect. But other than fatigue, I feel okay. I mean, from side to side, I get headaches and things like that. But I've been really trying to focus on, you know, eating well and exercising, even though it's hard from day to day. My doctor said that, you know, following like an anti-inflammatory diet is really, you know, has seen beneficial things following things like that. Cause, you know, platelets, she said, can increase your, make you have more like, more inflamed. But from there, she last visit, you know, just monitor. I think when, yeah, I have no children right now, but I think that if you are to have children, that's when she said, you know, monitor, definitely be on aspirin and then monitor. And she, you know, referred me to a family planning doctor inside of Dana-Farber. So that was really, you know, exciting to know that someone that has experience with, you know, ET and things like that.
Yeah, yeah. Yes, for sure. Keep all of the docs when you plan to have a child, you know, make sure that everybody's involved in that. And we can talk about that with the doctors in a minute. But thank you for sharing that. I'm going to go to Portia. And of course, Portia and Cam will probably have some thoughts for you as well, Allison. Portia, how are you? It's good to see you. And what's new?
Hi, Anne. How are you? I'm good. I guess, you know, lots new, but nothing is new at the same time. I'm currently at Wesleyan University. I'm in Connecticut at the moment, but I'm based in the Bay Area, California. So I have doctors both on the West Coast and the East Coast. I just turned 21, but I was diagnosed with ET at age 7, and I'm triple negative, which was found out through multiple bone marrow biopsies done over the past few years. I guess kind of what's new is I've been on interferon and Hydrea for the past almost 3 years now in the transition stage from Hydrea to interferon. I think due to like COVID and being in school, it's probably taking longer than normal, but it's been all right. I play squash here at Wesleyan, and I think just being a collegiate athlete also adds a lot to that as well. But for the most part, things have been going really well. I've been managing ET for a really long time now and balancing life and sports and school along with that. So, you know, in the beginning years is definitely a challenge, but I think I was really young, from like, you know, 7 to 15, I would say. So a lot of it was dealt with my parents, but now being in college, it's a lot more on my own, which has its own set of struggles, but a learning curve to say the least. But I think overall, I think things have been really, really well.
I'm glad to hear that. So glad to hear it. And I'm so proud of you for still playing squash. We just looked up, you're going to laugh because I was sharing, we were talking about you the other day and I said, what is squash? Cottonwood squash. And we looked it up. I thought, oh yeah. You know, it's kind of like racquetball, but not really, you know. But anyway, one of the questions I had for you was, you know, from the transition from Hydrea to interferon and the challenges you've been having, but you also, we had talked or emailed a couple months ago about getting to places, you know, to get your blood work done. Has that been resolved? And what I'm talking about are, we do have some systems and resources in place for people that need to travel, that don't have cars or don't have, transportation. And there are some things in place, but what did you finally find?
Yeah, so I guess a little bit of background, like I'm at school and so I see Dr. Podolcev at Yale, and Wesleyan to Yale is about like 30-40 minute drive. So I had an appointment in the fall with my mom, and she came out. This is the start of school, and we just drove there. But then I had another appointment on my own late winter before I headed home, and through that I worked with the people at Yale pretty much to figure out transportation, and it was really nice. A cab came to pick me up and then came and dropped me off back at school, which is really nice, and it was paid for by them. But I have actually another appointment coming up in a week, and I am still trying to figure out how to get there. But I have a lot of friends who have cars here on campus, so I'm gonna try and beg one of them to see if I can borrow it for a few hours.
But I will tell you, we do have, and I'll send
Yeah.
you some stuff, because I know the Leukemia Society and NORD,
Mhm.
a couple of those company or organizations do have services. They provide, funding or car services like Uber or Lyft or one of those, and they can,
Yeah,
yeah. And
yeah,
it'll
I
be free.
reached out to the American Cancer Society, and they set me up with their volunteer car service network. And I was planning to do that in February or January when I had an appointment, which then
Yeah.
got postponed. But yeah, they seem to know what they're doing and very reliable. So
Okay.
I'll definitely
Okay, good.
try that out for my
Yeah.
appointments are every few months, so it hasn't been too bad. But yeah, I think it's been working well.
Okay, that's good to know. And thank you, and we'll be back to you. And so Cam, how are you doing? How is school going? And how are you feeling? All those questions, what's new? And if you want to just share with the audience, when you were diagnosed and where we are today.
No, I'm doing well. I'm happy to be here. I was diagnosed in 2017 in August, right before my 18th birthday. So I'm 23 now. But I was initially diagnosed with ET, kind of a fluke. Long story short, I had a leg injury from running and my platelets were spiked, and the doctor was like, you should go check this out. So we checked it out, and I was positive for the JAK2 mutation. So that's how I found out. And I saw Dr. Mascarenas in the city for, a couple of years before I went to school in upstate New York, and going back and forth. And we discovered that it actually is PV. So I have polycythemia vera, not ET. So, in terms of that progression, people that are going to college, it is at first a little bit of an adjustment, but I think the best way to handle it is to just be a normal person, but don't neglect your symptoms and how you feel. So that's the biggest thing for me, is I was still able to have fun with my friends, but at the same time, they were driving me to the doctor. Like I had people helping me out. But also it's hard to talk to people about your symptoms. So you have to just try and, be as normal as you can be given the circumstance, and, be okay with the fact that you could be a lot worse. So it's really not too bad. And in terms of right now, I've been hovering around 1 million or so for platelet count. I think the most I've been at this point is like 1.2 million, but we were going to potentially look at interferon, but it keeps getting pushed off. It's very like on the edge of whether or not it's beneficial for me to take it. So as of right now, I just take 2 aspirin a day, and I get phlebotomized every few months. And that's kind of just where I'm at in terms of the current situation.
Mhm. That's interesting. I mean, we could ask some questions of the physicians about that after we come back, but Cam and Portia and even Allison, you're the 2 of you are in college, Portia and Cam.
Well, I'm not in college.
You graduate?
Yeah, I
Oh
graduated.
my gosh, I can't believe it.
Yeah.
Sorry, I'm just, I'm remembering these.
Yeah. No, it's okay.
But when you were in college, okay,
Mhm.
for those of you that were there, and for
Right.
Portia now, I mean, let's face it, you're exposed to so much and parties and, all that stuff. So when you do partake in whatever it is you partake in, if you do you find that you feel worse? I mean, are you worse than the average person? I mean, are you staying away from stuff and, like alcohol, I'll say, do you stay away from that? Because even the patients that I know that are in their 30s and 40s said, we just do not drink anything anymore because it just takes its toll on us. So could you speak to that, please, all three of you, Allison?
Yeah. So yeah, I'm a little older. I'm 31 now. So I was diagnosed at 29. I definitely don't drink at all, really. And I find I've been pushing it off for probably like 3 years, like even a little bit before I got diagnosed, but I just don't like the way it makes me feel. Like it's like, I know it sounds silly, but I'll have one drink and then like just feel really, really bad after it. And it's not like, tolerance and things like that. It's like, it takes like a day or two to feel better. And it's like, oh yeah, you're getting older. You can't drink as much as you used to. But no, I definitely would agree with that aspect of like, I don't feel great. So I just choose not to, which took a while to not.
We're actually going to be sending a survey out for younger people, between the ages of 18 and 35 or something. We're trying to figure out where to stop. But because all of a sudden I'm just hearing from so many patients saying, we're just not doing it. Portia, can you speak to this?
Yeah, I think definitely just being in a college environment is, in terms of being ill, has really been different. So I think throughout, high school and middle school, like I rarely got sick, like once every 4 years or so, if that. And if I got sick, it definitely like hurt a lot, like a couple weeks and then another couple weeks to recover. But in college, it's been really different. I've been sick 3 times in the last year and a half for an entire month. So it's been really brutal. I was last sick in October and pretty much had pneumonia by the end of October. So dealing with that was really difficult just because all my physicians were on the West Coast and I was on the East Coast. And like talking to my parents, we were like, I need help. Like I have no idea what to do. I have no transportation. I'm stuck with like the health center at my school who were not that helpful. Very nice people, but couldn't really help me. And that's also just the reality of having, a chronic illness that is very rare that no one knows about. So they're giving you like Advil, like, okay, you have a headache, here you go, good luck. But I think I've been very fortunate that I have people at Yale now who've been really helpful and helping me get medications. And I know that's more primary physician care, but just because I ET, they've been a good resource. So it's been a balance for sure. And I think also for how active I am at school, I like taking breaks and recovery has been a huge part of my life. So find that balance, like with having a social life and just schoolwork and all of that has been difficult, but manageable for sure. And in terms of like partying and drinking, like it's just being at college, it is what it is. I think I have a really supportive team and I absolutely love my team. And so I'll do events with them. And I think because I'm around them already for squash, like I know I'll be safe. And if I do choose to drink, like I know I have a support system. But for the most part,
do you feel, most people, if they drink too much, they get sick anyway. But I don't know if there are any studies, but it just occurred to me to ask that question because so many, in the last month, I would say I've talked to or emailed with people that are younger that are saying, we just do not, we've cut it out of our life, but I'm curious. That's why, like Allison, you sound like the other people I've talked to. But so when you do drink, is it more difficult, would you say, or just the same? If you
I think I would say like I know myself so well that I usually don't feel anything, or I don't feel any worse.
Yeah.
Okay.
Okay.
I would probably feel like the average, but I don't drink that much to begin with.
Yeah.
But I think just due to like how long I've had ET and how long I've been playing sports, I just know my body so well. And just like we don't have like dry season, which means you can't drink for the entire season. But because we're playing minimum 2 hours a day, like 5 days a week, and then we compete on the weekends, And like I've been here like on the East Coast all of January, like playing 4 hours a day and competing on the weekends. So my body's been through everything this month. And so I think just the recovery for just athletics is its own like workout in itself. So that's honestly way harder to deal with than like anything after drinking. So it's a lot harder on that side. But honestly, just finding balance and like knowing your body is key and your tolerance kind of at the end of the day. And I think I've had a lot of practice with that just because I've had ET for so long. I've not been drinking for that long, but just playing squash and everything.
Okay, thank you. Cam, do you want to briefly answer or speak to that just briefly? And then I've got, and then I want to introduce Sylvia. Kelly was with us. I don't know where she went, but I'll introduce Sylvia and your mom, Loretta, Cam. And then I've got a slew of questions here. I knew this would happen. Okay, go.
That's short and sweet. I don't drink, so it's, you know, that's it.
Okay. Okay, good. But not that you're bad, Portia. Good. All right. So I want to introduce Sylvia, who is the mother of a daughter with an MPN. And Sylvia, do you want to briefly tell your story and then tell us how Katarina's doing and what's new to this date?
Well, hi, Anne. Hi, everybody. We started, actually was discovered, she had no symptoms, no nothing. It was just discovered by chance. Our pediatrician did this whole CBC in every patient. And, you know, she gave me a call on a Sunday, we're getting out of church and she's like, you have to take your daughter to the ER. And I'm looking at my daughter, she looks fine. I don't see anything wrong, but I had to take her to the ER. So I look at my husband and I said, we have to take her to the ER. And we couldn't understand why. No, so she just wanted to make sure it was no blood clots, no nothing, because her platelets were over 2 million. So that's how we started. Now, when we started, we were referred to a hematologist that didn't know anything, that couldn't even give us a name of what she had. We were offered the first thing a straight chemotherapy, and I said, no, you either give me a name or I don't do this. Then we kind of negotiated and we got into hydroxyurea. So from there, you know, everything started. I started just researching every day. And that's how I found you, Anne. I found your organization. I contacted you and, you know, I told you, I just want to learn. So we started with the whole, you know, within the adult seminar because we didn't have for pediatrics. Then we were very blessed to meet Dr. Kucine, and we started from there. Katrina developed symptoms after the medication, though before the medication, she had nothing. But then with the medication, she started developing some symptoms. Mostly was her stomach or headaches, has always been headaches. So she was 8 years old. So I feel that it was easier for me as a parent when she was little. You know, you take this pill, you take this, and no, she runs. She loves cross country. She got into skiing club now. So she is very athletic. She likes sports. But once she started getting older, we started the whole teenager age. That has been a nightmare to us. Listen, I mean, I love my daughter to death. I'll do anything for her. But the challenges that come to having a little girl going into teenager age with the hormones. So I started discovering that, wait, is this ET? Is this hormones? Is this the month? Is this, what is going on? So I researched to, you know, I just came back to what I always did, my notebook. So I always, since we started, have keep like a journey. So, okay, this day she's feeling this. So I started noticing that, you know, yes, some days it was worse because of her hormones. And then we started Pegasus in 2021. And that was another thing, you know, one of the side effects of Pegasus is depression. So how do you know she's depressed because she's a teenager, or how do you know she's depressed because of Pegasus? So it's just been a learning process. She, of course, is more rebellious about all of this because she's a teenager. I think she's just tired. You know, when you're a teenager and you want to do all of these things, but you can't. We have another problems, which is the school system. Right now, I'm actually advocating at the Kentucky level. I live in Kentucky, so I had contact every single senator, every single board of education. They all know my name because something has to change. My daughter is taking a class that is a dual class, high school and college. And she was informed that this might not be for her because she's sick and she has to miss days.
Oh my God.
So it is a process, it's a process of teaching. It's a process of, and it's been difficult for her because she has to learn too. So I've been advocating for, in the school systems, how we cope with all of this. Well, my daughter, we're still looking for a therapist. We are in the 10 therapists that we have visited because she has no click with any therapist yet, but we're praying for one. We keep her active. She runs. She is doing the ski club right now. So we just try to keep her mind, busy. Just when she's sick, we just take care of her. She stays at home. And we just try to do our best. When she's falling behind in the school, I have meetings after meetings and we just help her go from there. If she needs a tutor, she will get a tutor. I mean, and it's been a process. I think it's been a hard process now that she's a teenager than when she was little.
Yeah.
How we cope as a parents, well, I guess I just took it on. This is what I have. This is what I'm gonna do. This is what is gonna be my life. I decided to combine just a small career, so I can have the time. But that was my decision, my husband's decisions. We just sat and we were like, okay, either I have all of these, so I wanted to have the time to research, to do what I had to do to help her prepare for college. So, I do have a full-time job that is very understanding. If I had to be out, I'm out. And everybody is okay with that. I go to the gym, something that I stopped doing a long time ago, but I go at least twice a week. It helps me mentally just to get ready for what is next. So just to think about what are we gonna do?
Yeah.
Like I said, it's always a challenge. So I think we just have adjusted. My son is in college. He has adjusted to that. We have adjusted. But the mental side of this, I think it has been the most important part for us with her as a teenager. She cannot trust her friends. She's not willing to say what she has because nobody will understand. But just she's out, and if she tries to explain to their friends, the first word that comes to everybody is like, you have cancer. Oh my gosh, you have cancer. You're dying. And she's like, no, it's not like that. Yes, it is, but it's not. So she finds herself in this position of, I'm just not going to tell anybody. And if I'm sick, I'm sick. So the mental side has been our focus lately, because I think that just her wanted to do what everybody else does. Her, she has expressed to us, I can't do this. I cannot do that. I cannot go with my friends. And it's very frustrating. It's, as a parent, it puts you down. I had cried. I have just some days I just go on my knees and I said, just give it to me. Just Lord, give it to me. But it's not how it is. So we had to be very careful. And like I said, just watching that area, helping her just accept what she has at this age is very difficult. But
well, I'm glad you brought up I'm going to move on to Loretta, but Sylvia, I'm really glad you brought up a couple of things. And that is, from her perspective and how she's, interacting with her friends, but also the school. And, that's just obnoxious that they would say something like that, but also the mental and emotional baggage that comes with this blood cancer for everybody. And so, compound that with a young teenager, who is trying to fit in, who's trying to be a part of the group. And, it's gotta be, and Cam and Portia and Alice, well, Allison was older, but Cam and Portia certainly, probably went through some of that maybe, I think. And, but let me move on, and Kelly's joined us as well, and she's the mom of a child with an MPN. We'll hear from Kelly, but Loretta, do you want to just give your parental perspective on, Cam's older now, 23, and he's out of college, which blows me away. Yeah. But can you share with us also, and then we'll move on and introduce Kelly?
Sure. Hi to everybody. I agreed with a lot of what Sylvia has said as a parent. A lot of what she was saying totally clicked with me as well. And the patients did a great job explaining, and Cam explains a lot about how he was diagnosed and everything. So I'm not going to go into that again. If you don't mind, what I thought I would share is some of the things that I felt are important pointers. For me, support is like key, and Anne, you have been so great to turn to. And the doctors, going to a fantastic doctor makes a huge difference. Reaching out, it's really important, because with my first son, I had severe postpartum psychosis. And in 1987, it's, you don't talk about it. So that isolation and feeling so alone that I couldn't turn to anybody with something like that. So I'm sure that's how a lot of these patients, especially the younger ones, feel. So if they could reach out to each other, that's why I love when we do this. And if parents could reach out, and if any parent wants to reach out to me, I'd be more than happy to discuss, because I feel that's so important. So that's one of the things I wanted to bring up. For us personally, right now, Cam's in the watch and wait, like he was saying, watch, wait, or medicate, and we don't know which way to go yet. So we're still contemplating what's the best decision for him, comparing, they say his symptoms compared to, are the medicines going to be beneficial, or could it be more harmful if he starts it at an early age? So it gets very confusing, and I get very frustrated because I don't know what the right thing to do is. Another thing I wanted to say is about maybe keeping a journal or a log. I think Sylvia had mentioned that as well. I think it's important for the patients to do that, how they're feeling maybe emotionally, as well as, what they're eating. Maybe eating is a big thing, eating healthy, exercising, yoga, meditating. And I know that Dr. Mascarenas always mentioned graze eating, and I do that for myself. So I try to get Cam to do that, because it's important to have those
Ask Mallory, she'll make you laugh. I eat all day long. Yeah.
the little mini meals. That's what I do. You always said graze eating. Go to your doctors prepared with your notes, a bunch of information or things from the last appointment that you can bring up, to the new one. And one more thing that I also wanted to say is, also, I made sure that Cam had, I bought him a bracelet. It doesn't have to be a bracelet. It could even be a paper that you keep in your wallet. But since he does do the phlebotomies and the aspirin, I just want any kind of medical situation to be aware of that. So to maybe keep it in your wallet if you don't wear one of those bracelets. So if you are, in some kind of emergency, you have notification that that person takes aspirins or they have phlebotomies or whatever.
We do have that card that we created for people to keep in their wallets in the event of an emergency. And that little card says who they are, who their what they have, who their hematologist is, and the phone number for that doctor, just in the event there's a surgery involved, or, any kind of treatment where they might not get what they need. But for all the right reasons, this card is very valuable. Thank you, Loretta. And I'll move on to Kelly. Kelly, hi, hello, how are you? Can you unmute yourself, kiddo? Down at the bottom, you'll see a microphone that's red, and just click on that. The bottom of your screen. Okay, well, Kelly's figuring that out. We have so many questions, and I think mostly for the docs. Now, her son should be able to figure that out. I was talking, my grandson's visiting, my older grandson, he's 18. Anyway, he was gonna help me today, but Mallory's with me, so we're all set. All right, so questions for the docs, and then we'll come back to Kelly. Actually, this question's for Cam, so I'm gonna ask you very quickly. Her son was diagnosed with ET. He has the JAK2G mutation. At 9 years old, he was diagnosed. He's now 11. His platelets are also near 1 million. And she's wondering if you've ever been asked to take or recommended a JAK2 inhibitor. Cam?
Me personally, no.
Yeah, no.
And that hasn't really come up for me. The biggest thing was always just monitoring and then phlebotomies. With the platelet number, Dr. Mascarenas always said that that's not like the first key sign of issues, more so just monitoring your symptoms themselves, seeing how you react based on what changes. So for me, it's hematocrit, and I think that's pretty common. So when my hematocrit is hovering past 45 is when I really start to see more symptoms that are noticeable. But I have never been on a JAK2 inhibitor.
Okay. And for the physicians here, are the chances of progression higher in teens or young patients due to the fact that they will have these MPNs for a longer period of time? Nicole, do you want to go first?
Sure. I don't know that I agree that the chances of progression are higher in young patients. I think, I think overall the chances of things like progressing to myelofibrosis and absolutely progressing to acute leukemia is much higher in older patients. We really don't see progression to acute leukemia in young patients. That's very rare and really never in children. I think it does make sense that sort of the longer you have a disease, the more likely you are to ultimately develop, problems associated with it. But and so, and maybe Linda can speak to this with, their PIA cohort really looking over time. I don't know if you're diagnosed with something when you're 12, are you more likely, let's say, to have a blood clot or to develop leukemia as an adult? That's a possibility because you've had something for longer. But in general, we don't see progression either to myelofibrosis or certainly to acute leukemia nearly as much in young patients. It's much more common in the older patients.
Linda, would you agree with that?
Yeah, and hopefully they're doing some construction out here, so I hope you can hear me.
That's all right. I don't hear it.
Good. But yeah, I agree fully with Nicole. And I guess one of the, I think, insight gained from this really long study where some patients were diagnosed in their 20s and followed until they were 70s, we learned definitively, just as Nicole surmised, is that the younger patients have a much slower rate of progression. And any of the ones in our cohort who did progress, it was when they were much older, like 70s, things like that. And I also think that with our newer therapies and all the knowledge we're gaining with sequencing technology, that, the future is even much brighter. And I think I was gratified to hear from all of you young folks that you're working out. Like, that's great. It keeps your blood vessels healthy. And as Portia pointed out, you actually sort of know how you feel much better, when you engage in activities. And so we're learning how that can be helpful. We're identifying new medicines that may actually decrease the allele burden. So that's super exciting. I know Nicole mentioned we're embarking on a study of younger patients with interferon, and that's one treatment we learned from our collaborators and colleagues in Paris looks great in older patients and shows a decreased rate of acquisition of mutations or increase in the burden of the mutation. And so I think the future is really bright. And I think it is clear that younger patients, have a much longer course of not progressing, and that with our new approaches and new treatments, we want to keep that never.
Yes, exactly. Thanks, Linda. Kelly, can you hear me?
Yes, I can. Thank you.
Oh, there you are. Okay, Kelly's with us. Kelly's a mom of a son, I believe, who has an MPN. I can't really see, I can see part of your face, but there you are. Would you like to share, your story, like when he was diagnosed, how you all are doing?
I was going to a different room. We're in San Antonio, and I did not expect to have a house full of children today, but it's 35 degrees, so they call it a snow day.
It's
There's
0 here, just to let you know, it's 0 here.
35. We shut the city down. So pray for us to, not get on icy roads at 35. And the Walker's doing well. It's still an emotional adjustment.
When
And
was he diagnosed, Kelly?
at last March, for sure.
Okay.
I mean, we really just thought, my husband kept saying common things are common. The first set of labs that were elevated platelets, he said, this is not going to be anything, we'll rerun them. My husband's an MD. And so we reran them and they went up again. And after a couple of those, we went over to Texas Children's, where they were great. And then they referred us on to the exact right person that we should be with, Dr. Kucine. And we were fortunate enough to get up there and become our patient. And right now we're just on aspirin. He had one incident where he had some pain of unknown source in his arm, which is kind of saying unknown is a little bit of a misnomer because he's also a pitcher. But we rushed him in and we got an ultrasound and it was fine. And I guess that's my biggest anxiety as a parent when he goes off to college is worrying that he'll throw a clot and not driving him crazy about that.
Yeah. So to the doctors, what do you say to the parents of a newly diagnosed child with an MPN? What are, because we can all say, we'll make sure they do this and make sure this and this, but that highly emotional yo-yo, that they are on for the duration. I mean, are there any tools that you can give patients? Dr. Kucine?
I think one of the best tools I can offer is to tell people not to Google too much. Because when you Google, you read horrible, scary things that are not related to your teenager. So I tend to try to encourage people to ask questions of me, of their other doctors, to talk to families in support groups. I know there's a number of Facebook groups, and I know there's a chat group here that some of the families have used. I think sometimes getting that information is a lot more helpful because most of what you find on the internet is really about like 70 to 80-year-olds. And that is, one, not going to answer your questions about your teenager, and two, is going to freak you out. So I try to encourage folks to be mindful internet users and not maybe read the wrong websites, which will just freak you out more and not help you. And it's one of those things where we're right, like Kelly was saying, like, common things are common, but rare things happen. So what do you do when you have something that's rare? It's okay to ask questions. It's okay to take notes. Sylvia, I think, is one of the people I've met who's really, really good at like advocating for her kid. If you don't understand why something's being done, you ask. Doctors are human. We make recommendations. You don't necessarily have to follow them. You're allowed to question them. We're not going to recommend things we think will harm your child, but like, if you don't understand why we're recommending them, then we're not doing our job. You have to understand. So you are allowed to ask questions. So make sure to ask questions. No one should ever be offended if you say you want a second opinion. Like if they are, then maybe they're not a great doctor. Like I see patients all the time for MPNs for a second opinion. I also send people for second opinions to other doctors for things that I'm not the expert in. So I think if you don't feel comfortable with your doctor, or they say, I've never seen this before, I think you should speak to someone else, like that's okay. Get a second opinion. You don't need 8 opinions because that'll just make your head spin, but having a second opinion sometimes is absolutely fine. And using resources like, the MPN advocacy education group, because there's stuff on the website there. There's people like Anne who are in the know and can connect you with doctors and other families and things like that.
And that's the other thing. I just want to reiterate that Loretta, Sylvia, and there are others, Celia, who couldn't be with us today, who's been around the block, with her daughter, who's now in her 40s, but was a teenager when she was diagnosed. So, and they're all willing to interact and communicate, Kelly, so I can hook you up with that as well. But Linda, did you have anything to add to that?
Just, I think the education part is just so important. And just as Nicole mentioned, I spend, usually the first appointment, even if they've seen other hematologists, extends well over an hour. I want to tell them about it. And the other thing, we like to work with other pediatricians and other providers so that the patients are comfortable, but also because it is so rare. Like Nicole and I, we sometimes see the same patients. It helps them feel more comfortable that we're both on the same page. And we realize we're a rare entity, people who specialize in young patients. That's why we're establishing this international consortium, because we want to put all of our heads together. And, when I've had patients in college, I realize sometimes those health, just as Portia was saying, sometimes the healthcare system is not the most knowledgeable, but, we can interact with them. We can send them emails, we can talk to them. And so that's something I always emphasize to my patients, because not everyone lives near New York, not everyone lives in Baltimore. And so we're very accustomed to working with your primary doctor. And, the other thing is, if they sometimes end up seeing somebody who's used to older patients, we steer them away from what's often done for older patients, because that's not necessarily the best thing for younger patients. So I think education is really, really important. Not only
that's a great point, Linda, because what I have found in the MPN space, I used to be in breast cancer and prostate cancer prior to this 20-year stint. But what I will say is what I've discovered about MPN physicians is how absolutely open they are to receiving messages, being on the call with your primary care physician. It's just been remarkable. You two and the others are phenomenal people. They really are. They're really, really wonderful. So you have such great, great resources and great people that can help you and listen to you. There are many times I take phone calls and just listen. I go sit in another room and just let moms and dads and whoever it is tell me whatever they need to tell me. And then I can kind of feel you out and figure out what you might need, even if it's just listening, but I might direct you to, have you email Sylvia or Loretta, or there are several others that you can connect with, Kelly. I'm saying this more specifically to Kelly, but the other moms and dads on the call, know that we can help you. All right, I have a question from a 30-year-old female. Oh, who was going to say something?
I said, y'all have done wonderful.
Oh, yes, they are. This is from a 33-year-old female. Is there any data to support iron supplementation for those of us stabilized on Besremi? She's 33. She was diagnosed with PV at age 29, but had symptoms of ET with platelets at over 500 since age 3 or 4. That's interesting. My hematologist recommended I incorporate iron since I've been stabilized on Besremi. Linda?
Yeah, so that's a really interesting question, because, when people have PV, their body's making more blood cells, and your blood cells require iron. So many of our patients are iron deficient. And that, I think, is one of the beauties of the medications that don't require the treatment that does not require phlebotomy, because that can, get rid of the iron deficient, which can make you tired, and some people have trouble focusing. And so we've had many patients who oftentimes just getting them on Besremi, or in some cases we've had to use Jakafi, the JAK inhibitor, for example, for a patient with a liver transplant who had some liver test abnormalities on the shorter acting interferon. But so many times just transitioning away from phlebotomy will cure the iron deficiency, but in some cases it doesn't, especially, potentially for a woman who may menstruate or may have, other sources of blood loss. And in that case, we have supplemented when it's clearly a deficiency and the counts are well stabilized on Besremi. But sometimes just going to a different treatment alone will be sufficient, and it can take a while. So as long as the diagnosis is secure. I even had a patient where we thought it was iron deficiency, but it turns out, in addition to PV, this patient also had a mutation that causes small red cells. So you have to be sure that it's really iron deficiency if you're going to treat it, because not everything that causes small red cells is iron deficiency.
Nicole, did you have anything to add to that?
Nope, I agree with what Linda said.
All right. Any recommendations to treat, am I saying this correctly, Raynaud's symptoms? Let's see, where did that go? I'm getting all these questions here. Other than the usual recommendations to keep fingers and toes warm.
Ooh, I don't
That
think I have
is-
any magic for Raynaud's. Yeah, that's frustrating, but I don't know of any magic bullets for that one. I don't know if you do, Linda.
I mean, do a lot of our patients have that? I mean, I know that our patients have, extremity issues,
I mean, some people do, and it's just common in the general population as well. So it may or may not even be MPN related. But yeah, I don't know of any, and it's definitely less common in, like, younger kids as opposed to young adults and older adults.
Okay. Linda, have any?
Yeah, I mean, I actually have Raynaud's. So I can't.
Raynaud's, is that how I say it?
Yeah, so
Okay.
those little heaters, that you can get for skiing, I have some of those if I ever have to.
Oh,
go
I
out.
have those too.
Yeah, and mittens are better than gloves because it keeps your fingers together. More
think-
woolly socks.
I think I knew one patient that actually shared that information and said that they get acupuncture and it kind of helps it.
I think
So,
acupuncture is good for everything, probably. So that's definitely possible.
probably.
There's a lot of things. So
Let's see. My son is 16 and was just diagnosed with ET. He's CALR positive. His platelets range from 1.3 million to 1.7 million. He feels fine and goes to the gym, to the docs. And he's for the two of you. Any studies with aspirin treatment? He refuses to take it. I've read that kids with ET so well, even with super high platelets, do well with even with super high platelets. So even with high platelets without clotting episodes, what are your thoughts? Why are patients prescribed hydroxyurea and other meds?
that's a lot of questions.
Linda,
So-
yeah, there's a lot of questions.
There's a lot in there. I don't know what your thought is, Linda, but so aspirin is very clearly indicated for people with a JAK2 mutation. I don't think there is any rule about aspirin with other mutations. And I personally have followed teenagers with CALR mutations who have very high platelet counts, and I do not have them on aspirin. And the reason is because when you develop a very high platelet count, and usually we use the word like extreme thrombocytosis, which means over 1 million or 1,000, depending on how you write it. You can often have bleeding symptoms when your platelets go that high. So if a patient has something called acquired von Willebrand's disease, which the doctors, if you're going to see a doctor at CHOP, I'm sure they'll test him for that. We generally don't put those patients on aspirin because of the bleeding risk. So I think aspirin is clearly indicated for someone with a JAK2 mutation, not so clearly indicated for other things. And especially if you have very high platelets and a bleeding risk, then even if you do have a JAK2 mutation, you may not be someone who can take aspirin. And so that is sometimes one of the reasons, then, to answer your second question, I guess, of why the other meds are prescribed. So I think this is a controversial question. There's not one. If you ask 20 different pediatric hematologists, you'd get 20 different answers about why you should treat someone with an MPN with a what we call cytoreductive medication like hydroxyurea, like interferon. So there's a lot of different reasons. Certainly, if someone has had a blood clot or a major hemorrhagic bleeding event, those are reasons people would treat a younger patient. But sometimes it's just someone might have a very high bleeding risk. Let's say they have really severe acquired von Willebrand's disease and they're a lacrosse player and this is their whole life and they want to become, I don't know if this is a professional sport, but this is their life and it is a huge quality of life issue that they can't do this sport because of the bleeding risk. That's a conversation when we talk about, thinking about cytoreductive treatment. With things like interferon, people say, should we be using more interferon to slow disease progression, even if a kid feels fine and has no actual symptoms? So I don't think there's one right answer. The one thing that I personally feel strongly about is there are some doctors who will just automatically want to start a patient because their platelet count is over 1,000. or over 1 million. And I don't think we have any data for that. There's not like a magic platelet number that is the right number to treat at. So I think there is a lot of thought process and conversation that has to go into the decision to start someone on a cytoreductive agent. I don't think it's just based on one number. But there are definitely times where I think a lot of people would agree to treat. And then there are times where if you ask 10 doctors, you get 10 different opinions about a particular
I absolutely have seen it. I've watched it. I've heard it. You know, I've heard from West Coast to East Coast, different treatment protocols for, you know, I mean, it's mind boggling. Right. And so Linda, would you like to add anything to that?
No, I absolutely agree. And I think some of the doctors who are starting it may not be as experienced, because with Nicole, as she mentioned, sometimes the high platelets actually causes bleeding, not clotting. And so the aspirin wouldn't be what would be the desirable thing. So it sounds like this patient is doing all the right things. He or she feels great. They're working out, and they realize a platelet number is not really linked to thrombosis. And even our study, that was recently published showed no relationship between platelet number and thrombosis. So, you know, and that's been observed in older patients as well.
Wow, that's so interesting. All right, this is for the patients here, and I'll start with Allison. And you may not have said this, but you could probably relate to this. And that is, the question is, when you say when you do feel sick, or when you do feel symptomatic, what do you mean? What are the symptoms? What's worse? What's okay? What's, you know?
Yeah. I guess like how I started, I just felt off. I think it was, I'm trying to get her name. Portia was saying, like, you know, you get really in tune with your body, and you're more fatigued or tired. I'm a teacher, so isn't my husband. So we have the same job, and, you know, teaching is a very stressful job as it is, but when he comes home, he still has like this energy to, you know, work out and, you know, do yard work or whatever. And I'm just like, I'm kaput. I'm on the couch. Like I need the rest. So I guess it's nice to have a relation with that, but just feeling like I'm just a little bit more tired and like more frequent headaches more than anything is more so my thing.
Okay, Portia, when you know this is the MPN doing its thing, what are the symptoms?
I would say very similar to Allison, a lot of fatigue. It's hard for me because which is how much I do, like what's real life and normal life versus an NPN. But I think, like if I'm like after school or after squash, like I'm really tired and like all I can do is sleep. Like I can't even hold a conversation. That's how tired I am. I think that's more where the NPN kicks in, and also just side effects of the medication as well. I'm on interferon and hydria, and I think just because of interferon more than hydria, just because I've been hydria for so long, that I'll feel it like the day after, like I'll be like a lot more tired. And I can, because I know that, I can plan it out better with my schedule and take that rest day. But on occasion, headaches every now and then. But I think just because of what my life is right now in college, like there's a lot of stress, just a lot of things going on. So fatigue just all around.
Okay, and Cam?
Yeah, I think for me, it's not really a day where I'm just like, oh, I'm like really sick. It's more so just consistent symptoms. Like I have floaters, so I constantly like just something I've grown accustomed to, but like, you know, if I look up, I see them everywhere. I don't know if other people have them, but like itchiness out of the shower, you know, clear-cut signs that it's from the disease and not something else. But fatigue is my most frustrating symptom for sure. I started drinking coffee like a month ago, and it helps a little bit, but yeah, fatigue is the worst. And I think some days it is hard to understand because I'll sleep like 10 hours and I'll wake up and my eyes are like sealed shut. So I don't really know. That's the best way I could explain it in terms of that. And then I do get occasional headaches, and I think those are hard to tell because of stress and other things, but those are basically it from the perspective of symptoms.
So Cam, will you remind me again what you're taking, if anything? I can't remember.
Yeah, I just take 2 aspirin a day. And yeah, so actually I get tested for the Von Willow brand panel because I'm over 1 million platelets, but I've never had it. So as of now, I stay on aspirin.
Yeah. I'm not a physician. But if you were my son, I'd be asking you about interferon, but anyway. All right, so more questions here. And then before we wrap this up, I want to go to each one of you and ask you, to speak to the other people out there that are either your age or around your age, and what you would say to them. And then to the moms, what you would share, and then to the physicians and what we can look forward to on the horizon. This is for the physicians. What is your cutoff platelet level for when someone with a JAK2 who needs to start therapy beyond daily aspirin? I know it's important to understand symptoms, but at what number or level of platelets do you feel that it should be used? Linda?
Well, I think this goes back to what we discussed earlier. I don't think there really is a magic number to treat, and it's really not related to complications either. So, we tend to treat, I tend to use interferon because it can decrease the allele burden, and I like to avoid iron deficiency if I can, and certainly that's associated with phlebotomy. Yeah, we don't really treat by a number in general.
Yeah, and there was that study, I think it was 2 years ago or 3 years ago about the blood levels, what's happening with the blood versus the symptoms.
Mhm.
And it was really fascinating to me because you could certainly see what's going on with people when you talk to them, and it's like, yeah, my platelets are like this, but I feel great. Or the other person,
Yeah.
my
Those
platelets.
I was
Yeah.
going to mention is just so that somebody doesn't get a misunderstanding, but the
Yeah.
hematocrit in PV, we certainly pay a lot of attention to because there's very clear evidence when it gets beyond a certain level, clots are at high risk. So that number we stay attuned to, but the platelet count doesn't seem to correlate with anything in general for a young, healthy person. If you're older and have cardiovascular disease, there it may link up, but not for our young patients.
Nicole, I saw that yawn.
That was a cough, sorry. Yeah,
Bless
I
you.
agree. Like, I don't have a magic number. I'm gonna be honest. Like, it's really the platelet number alone is honestly not something that drives me to treat. If it's something, again, where somebody has a bleeding risk because of the platelet number, and that's either they're bleeding or it's preventing them from doing things, that's different. But just the number itself, I don't have a cutoff either. And again, that's one of those things where if you asked a bunch of people, and I've done this at meetings a number of years ago, said, what's your treatment cutoff? Like, everybody had a different number. So I think that's just a sign that we don't have a clear number. That's not
Right.
sort of magic number for MPN treatment.
Right. One last question for the patients, and then we're going to go around the screen, so to speak. This question is, so when if you're involved in sports or you're in an activity and you get injured, do you find that your injuries take much longer to heal? And could that be, and I guess the physicians could answer this as well, is that kind of a symptom of, someone with an MPN? Portia, I'll start with you, like the squash champion of the world.
I would say yes, a little bit, but at the same time, just the nature of the sport and the nature of how much I do, and the athlete mindset that I have, I don't take the time fully to recover. I just keep playing, and deal with it. And at the end of the season, like, if it's still hurting, then we deal with it. But I think also because of my MPN, I'm a lot more cautious, and careful just about how I play and how I deal with recovery. I recently had a really bad knot in my calf, and I got metal scraped for it, which was probably the worst decision I ever made because I had a huge bruise because of it, and it's still there, and it's been like a week and a half now, and a lot of ice and recovery. But I think just you have to just know your body really well and see how far you want to push. But I guess to answer your question, it does take a little bit longer, but I think I know my body well enough to know, oh, it's okay to keep playing.
Yeah.
And I have very supportive trainers and coaches who understand, if I gotta stop, I gotta stop.
But what about wounds? Have any of you had like a wound where it's cut and bleeding? Because we have heard that sometimes it takes much longer. Cam, has that happened with you?
No, I haven't really had any experiences with like a cut or bleeding personally. In terms of injury, that is actually how I found out I had the JAK2 mutation. Is I was running so much. I was running in high school around 10 miles per day, and I actually had a stress fracture in my femur I was running on. So that is why I had to go to the doctor and find out. So there really is no way to say if that had any correlation to the fact that I was, I had this mutation or not. But in terms of injuries, I think it is just monitor your body is really, I don't think there's like any significant difference between us and someone who's just our age. It's just all about taking care of your body.
Okay, thank you. Allison, any input on that?
I guess bruising is probably like the biggest one that sticks around for a while. Like I'll have bruising sometimes that lasts for like a month or so, but besides that, luckily I've been pretty healthy besides this. So I would say also probably like being like sick in general, like the common cold will take me a little bit while to get over compared to, my husband or things like that. But besides mostly bruising.
All right, and to Dr. Kucine or Dr. Resar, anything added? Am I thinking of something else? But it seems to me like open wounds, maybe for older patients, seem to be an issue in terms of healing.
I mean, I think bleeding we know is a thing. And I
Yeah,
guess if someone's on like hydroxyurea or a medication that lowers your white blood cells, and if maybe it's not well controlled and your neutrophils are too low, that's a type of white blood cell you need for healing. Maybe that could be involved, but I don't know if there's other things specific about an MPN that should really affect like wound healing per se.
okay.
I don't know, Linda, what do you think?
I would agree. In the bleeding thing, I had a patient who was playing basketball and got a bleed and it wasn't really very well recognized. He'd been put on aspirin, which he really wasn't benefiting from, and got like a compartment syndrome. So bleeding is a really important thing to watch out for, and to be careful with. It sounds like Portia knows her body well. When she gets a bruise, she knows she has to be careful with that, and she ices it and takes good care. But sometimes if a patient isn't with a doctor who really knows MPN, it could be unrecognized or not really appreciated how to manage.
So I want to just go around the screen. We have 10 minutes basically here. And I'll start with Allison, even though you're kind of new to us and new to this disease. Are there first of all, is there anything you would like to know that you haven't learned enough about? And, I hope that you will join us at some of our other webinars and our in-person events. We're going to do the 9th annual Women in MPN program in New York City in September. And I hope that these two physicians will join me there. And I hope that anybody is welcome to come, but is there anything that you need from us or that you would like to share with the others watching?
Yeah, I went to see you, I forget what month it was, in Boston.
Yeah, I remember you there.
Yeah. So that was great. I mean, I think that, like everyone said here, getting educated and researching and asking your doctor's questions is probably the most like beneficial, instead of like Googling everything, because that's definitely what I did in my first year and just trying to like process everything. But my biggest takeaway in the past like year and a half is just finding support and reaching out to people and joining groups like this and online as well. And knowing like, the difference is like between like JAK2 and CALR and how those two are definitely, the treatment is different. In Dana-Farber, my doctor said, I'm kind of like CALR, I'm young, the least, likely for, different things to come up. So just being proactive is probably the number one thing I would say. And just like Sylvia was saying, is that the mental side is kind of the hardest, has been the hardest for me. And whether it is going to therapy or talking to someone about it, I think that that's most takeaway for me. And I think it was, I forget her name, but Cam's mom was saying that, yoga, active, sorry, my dog's barking. But,
Yeah, that's okay. That's okay.
is probably the best for me so far, is to, getting out there and active, and yeah, just happy to be here and happy to learn. And if something feels off, tracking symptoms and things like that has been the most for me. So thank you.
Thank you very much. And I'm really glad you were with us today. I mean, it's nice
happy
to
to
see
be
you, and we'll see you again soon. Portia, what would you leave this audience with?
I think for me, just being diagnosed so young, it's just, you have to be really, really patient. And, there's a lot of trial and error. And right now, just still going through the process of transitioning to interferon. After the first year, like, I easily could have given up and, I was like, why am I doing this? Like, it's not even working. But I definitely stuck with it. It's been, nearly 3 years now, like I said. And I think it's so beneficial. And I'm really happy I'm making that transition, but there's been a lot of setbacks for sure. I think so, just overall being patient. It is a chronic illness. So, we'll have this for the rest of my life. And I think with that, also because of how long I've been dealing with ET, just knowing your body really well will help you in the end. I think even more like just, talking to your doctors and having that support system. It's not something that you can do alone, and it's a long road. So just communicating with the people that are close in your life, and just having a positive attitude has helped me a lot. It's very easy to get caught up in the negatives, being an athlete, being in school, like kind of what Sylvia was saying, like especially in high school, like you miss out a lot, and having friends who don't always understand, even as hard as they try, they can never really get there. So just taking care of your definitely physical health, but your mental health as well, has been what's working for me. And just overall finding people who support me and love me has been really helpful. So yeah.
Thank you, Portia. Cam?
Yeah, so I think what Sylvia said about your friends finding out stood out to me the most in terms of what I want to leave to other people is like, they're like, oh, cancer, like it's very hard to explain your situation. So it's not necessarily them fully getting the background of it, but more so that they're not going to, be like, why are you incapable of doing this? Like, as long as you have a good support system and people understand that you're just a little different, and then that you're okay with that too. So the big thing for me is just a positive outlook. When I go to get a phlebotomy, there's people around me that are getting chemo. I could have it much worse than I do. And at the end of the day, my symptoms are adjustments, and everyone has to make adjustments in life. And as long as you're okay with that, you're perfectly fine. I'm very happy. It's very frustrating to be fatigued, but it could be a lot worse. And, I trust, like you were saying, Anne, like we have a great support system in the MPN environment. So I trust my doctors fully. We have like endless resources and information. And if anything were to get worse, I know that I'm in good hands. And that's very, makes me very calm. And that's all you could do.
You just said something. My mantra in life is a series of adjustments, and you just said it. And you're the three of you are just pretty amazing. And Allison, I hope to get to know you as well as I've gotten to know Portia and Cam. You're just lovely young people, and I adore you. And thank you for being with us. And I'm going to have Cam put the camera on his mom, Loretta.
I pretty much said everything that I was going to say. I mean, Dr. Kucine, it was perfect when she said about the Google, because that's me. I Google everything, and I get totally afraid of everything I read, because I am reading things that are probably for the older patients. But one thing that I did want to mention that I forgot before is I have a heart issue. So one of the first things is I brought that up to his hematologist, because I was afraid with his MPN, could anything happen with him with heart issues? So his doctors at Duke recommended that he sees a cardiologist that was specifically like for the, hematologist cardiologist. So if anybody else, if you notice anything that maybe you have symptoms, maybe it's a good idea to find out for, your child or whatever. I took that other step because I'm like, oh my God, cardiac. And I know heart can be affected. And also gastro. I know somebody else mentioned before that their child had like stomach. I don't know if it was Sylvia, that your daughter had stomach issues. We have that also, you know, Cameron has some stomach issues. So I know other parents have mentioned gastro issues and how much that's part of the MPN and not. Is it related or not?
Good points, Loretta. Thank you very much. And
Thank you for having this.
Oh, I'm just so glad to see you all. And Sylvia, what
Yes.
wonderful things would you like to impart?
Well, you know, I just want to say thank you to Allison, Portia, and Cam. I mean, this is what I'm looking for, you know, for my daughters. So just getting their perspective is amazing. And just for other parents, you know, just, I guess the support group, have a great support group, you know, either church, family, friends, somebody that will not feel that they had to ask you questions, but like will pray with you, will make you feel at that moment that you just want to quit, you know, lift you up. Listen to your child. You know, your child is the only one that is going to tell you how they feel, what they are feeling. Listen to them. They know better. And ask questions. I mean, poor Dr. Kucine, she gets so many emails from me, but I just need to know, you know, I just want to do the best for my daughter, but I'm not a doctor. I'm just a mom that is worried. So ask questions, always reach out to other parents, you know, doctors, just you and just never give up in your, you know, just knowing more how to help your child. So I guess that's my parent side.
Yes. Kelly, do you want to add anything? I know you're new to this as well. And, you know, we want to be here to support you.
I'm so grateful. This is for, I'm losing my voice, for
That's okay.
the entire group. And Dr. Kucine, I could just go on and on about what a treasure she is. I think for us, it was trying not to learn everything in the first day, because like I mentioned, you pull up articles, but they're related to people that are 75, have had 2 heart attacks, diabetes. That's not a patient like our kids.
Yeah.
And there's so many comorbid factors. And just to try to decipher it, give myself time to learn a slower pace and decipher. And then, you know, deal with the fact that sometimes it can really make the whole disease can make you feel panicked before you realize that this is something your child can die with and not of, which is where I think we are now. I mean, there's the points of, I'll call it our lunacy at the beginning. When one day I asked my husband, just buy your own ultrasound machine. Now, he's a radiologist, so that's not as strange as it sounds. But I wasn't kidding. I was like, just buy one. You know, we'll have it in the house. We can just scan them before he goes to bed at night, like brushing teeth. And it sounds absurd right now, but I really wasn't. This was 3 or 4 days after diagnosis, and we were sitting on a plane. We hadn't told Walker to have me back from a trip, and I looked at everything. That's what we're gonna do. You're gonna buy. And he goes, and then do I take it to college with him? I mean, it was an absurd idea, but that was a level of panic at that time.
Yeah. Yeah.
That I wanted our treatment plan to be at home ultrasounds every night, because that really endears you to your teenager.
And I have to tell you, you know,
but we calmed down.
Yeah. I was just going to say, you know, as a parent, and thankfully my daughter's healthy now, but she did have cancer, but it was a tumor that was taken out. But you know, it was frightening. I was terrified, and so I feel for all of you, you know, in that position of having a child that is going through this. But I will say this, after all these years and these wonderful physicians with us today, and all of those in the field, you are in such good hands. And the people, look at these people here, you parents and young adults. I just feel blessed to be in this space, and I'm so proud of all of you. Okay, so we're going to now hear from Dr. Resar. We'll go with you first. What would you leave the audience here to look into the future of MPNs for pediatrics and young adults?
Well, first, I just wanted to thank everyone. You all are incredibly inspirational, wonderful role model people for all of us. You know, as Ann mentioned, you're philosophy on life is very positive, and I can tell that Sylvia, your child is doing well because of you, and Kelly, I think you're doing great as well. So thank you all for sharing your stories and your optimism, and that's really what I want to say about the future. I mean, I think with technologies, we're learning to do sequencing, we're learning to really dissect what's going on at the cellular level so that we can get you all the best treatments possible, know when to do treatments and what are the best treatments. And we want you all to live to 100 and to be very healthy and, play squash for the rest of your life, or do running if that's what you do, teach your children. We want you all to be well, and we appreciate you sharing your stories, your optimism, and we'll carry on from our end what we can do.
Thanks, Linda. Nicole?
Yeah, I would just echo what Linda said. I mean, there are some amazing young people living with MPNs who are really a great resource for other young people. And for sort of the new moms, there are a lot of really, and I'm not to say anything bad about dads, but we tend to spend more time in conversation with the moms. I'm not going to get into why that is. I don't know. But there are people who have been sort of advocating for and helping their kids sort of learn to advocate for themselves for a long time. So I think you have really good resources there, and Anne has really helped build this like great community. And so I think the fact that there are doctors like myself and Linda and a lot of other colleagues of ours who are really interested in trying to learn more and improve things for MPNs, and the fact that there are patients and families like all of you who are so interested in participating and sharing your experiences and wanting to be part of research and make things better for other patients, I think that's sort of like a recipe for success. So I feel very good about the possibilities for the MPN community at large, and especially, again, I'm a pediatrician, so I'm biased, but I think we're going to learn a lot more about young patients over the next 5 to 10 years, and really hopefully things will look different. And there's so many new medications being tested in adults that we'll hopefully be able to start looking at for the kids who do need them. I think the more we get international groups together talking about treatment, the more we'll get a better idea of who do people really think need to be treated, who don't, who can do this sort of watch wait, like we were saying before, Loretta. So I think we're just going to keep learning exponentially more because of people like you who are really interested in being involved. And so I think that's great.
I mean, I look at the three of you and the moms, but the three patients here, and I think you will be in history books. I mean, you will be in medical history. You are making medical history right now if you're followed through the years. And if I mean, the studies that the two physicians here are doing, I just have a lot of hope and a lot of optimism. And you're terrific people. Thank you so much for joining us today. I'll be in touch very soon. It was nice to see you, Allison, Portia, and Cam. Thank you so much. Sylvia, Loretta, Kelly, thank you so much. And of course, Linda and Nicole, thank you so very much. And I'll be in touch soon.
Great. And thank you to everybody who asked questions. Those were great questions.
Yes.
Yes.
Send any questions.
Yeah,
Okay.
Anne always knows how to reach us. So if questions come up after, we're happy to keep discussing.
Yeah, they really are. So thank you very much. All of you take very good care of yourselves, okay?
Great
Bye.
to see you
Have a
all.
good rest of the
Thank
day.
you. Bye.
Thank you.
Bye.
Bye.